To hold the heart in anatomical position, first identify the pulmonary trunk, which is the outflow tract of the right ventricle. Posterior superior is the arch of aorta with its three branches. These two great arteries must be superior with the pulmonary trunk in front. Now you can identify the left ventricle. Trace the inferior or diaphragmatic surface. Place your left hand as shown and place the inferior surface of heart on the left palm with the apex directed anteriorly and to the left. So that is the apex formed only by the left ventricle and it is anterior and to the left. This is how you will hold the heart in anatomical position. Once you hold the heart in anatomical position, it's easy to identify the chambers of the heart. So this is the right auricle with the right atrium. This is the right ventricle and its outflow tract. You can see it's a pulmonary trunk. This is the left ventricle which forms the apex of the heart. So once you have seen the apex of the heart, exactly diagonally opposite to the apex, you should be able to see the base. Diagonally opposite to the apex, you have the base or the posterior surface. Let's turn around to see what forms the base. The base of the heart is formed mainly by the left atrium. How to identify the left atrium? You have the openings of superior and inferior left pulmonary veins and the openings of superior and inferior right pulmonary veins. So when you see four pulmonary veins draining into one chamber, so that will be the left atrium. Thus, the base of the heart is formed mainly by the left atrium and a small part is contributed by the right atrium as well. Now this is the small part of right atrium which contributes to the base of the heart. So once you see the apex, diagonally opposite to the apex will be the base of the heart. So viewing the heart from anterior, the pulmonary trunk is front whereas ascending aorta is behind. So this surface which you see from front, that is the sternocostal surface formed mainly by the right ventricle and small part by the left ventricle. So here we can see the apex formed by the left ventricle. So this is the sternocostal surface. On the sternocostal surface, between the two ventricles, we have the anterior interventricular groove. Lodged in the anterior interventricular groove, we have the anterior interventricular artery, which is also called as a left anterior descending artery. This artery is a branch of left coronary artery. Accompanying this artery, you have the great cardiac vein. So, anterior interventricular groove contains two structures, namely the anterior interventricular artery and the great cardiac vein. To see the posterior interventricular artery, place the heart in anatomical position. The surface resting on the palm is the inferior or the diaphragmatic surface formed mainly by the left ventricle and small part by the right ventricle. Between the two ventricles, you have the posterior interventricular groove in the diaphragmatic surface. The posterior interventricular groove lodges the posterior interventricular artery, which is accompanied by the middle cardiac vein. The posterior interventricular artery is a branch of right coronary artery. Between the atria and ventricles, we have the coronary sulcus. The word corona means crown. The coronary sulcus can be divided into right anterior, left anterior, right posterior, and left posterior. In the right anterior coronary sulcus, we have the right coronary artery, which is a branch from the anterior aortic sinus. This artery emerges between the right auricle and the pulmonary trunk, cuts the inferior margin of the heart, runs along the right posterior coronary sulcus up to the upper end of the posterior interventricular groove. In the left anterior coronary sulcus, we have the left coronary artery, which is a branch of left posterior aortic sinus. The left coronary artery emerges between the left auricle and pulmonary trunk and immediately divides into two branches, the anterior interventricular artery and the circumflex artery. The circumflex artery winds around to reach the left posterior coronary sulcus. This is why it's called as the circumflex artery. It winds around to reach the left posterior coronary sulcus. In the left posterior coronary sulcus, it is accompanied by the coronary sinus, which is the major vein of the heart. The circumflex artery ends by anastomosing with the right coronary artery. Place the heart in anatomical position. To the left and posterior, we have the left posterior coronary sulcus. Lodged in the left posterior coronary sulcus is the coronary sinus. Coronary sinus is the major vein of the heart. The coronary sinus is accompanied by the circumflex artery, which is a branch from the left coronary artery. The coronary sinus drains into the right atrium.